We're going to be looking at CAT scans. And CAT stands for Computerized Axial Tomography. The problem with conventional X-ray images is that it shows all depths in the body superimposed in one image. So it's a 2D image of a 3D object. So just imagine if you had a 3D object and you was to squash it so it was flat, that would be the conventional X-ray image. So you'd have no idea of the depth of the objects inside the body, and you'd also would not know if there were objects that were overlapping each other in the conventional X-ray image. CAT uses X-rays to produce images of one slice, that is one cross-section of the body. As the X-rays cannot be focused onto a chosen plane in the body, what we do is we pass the X-rays through the same section of the body from different directions in order to obtain the slice. So the X-ray tube produces a thin fan-shaped beam of X-rays which passes through then a thin cross-section of the body, and this X-ray tube is rotated around the patient, obtaining an image each time, and this is a ring of detectors that detect the X-rays that have passed through the same cross-section of the body. These diagrams show the shadows cast by the objects in the same cross-section of the body. You can see that the shadows cast depends upon the direction of the X-ray beam. All the data from a full rotation is then sent to a computer which processes the data to construct the slice of the body. To obtain a 3D image, the patient is moved bit by bit through the CAT scanner, and each time the patient is moved, a new slice is created. So the X-ray source moves in a spiral around the patient to produce these several slices. And then these slices can be stacked together to produce a 3D image. And here is a 3D image of the brain. CAT scans have a much better soft tissue contrast than conventional X-ray imaging. Also, CAT scans 3D images are possible, so you can view at any angle or cross-section, unlike conventional X-ray imaging. However, the dose of X-rays is significantly higher for CAT scans because you need to take multiple X-ray images to get a single slice, and as a result the procedure is much more expensive, and it requires the patient to be cooperative, to be still while a full rotation is made to get that slice.